Welcome to the Roots Sports Performance Podcast. As always, I'm your host, Sean Pitcher. Today's guest is Jessica Beal. She is a sports pharmacist, receiving her doctorate of pharmacy from Mercer University. She serves as the director of clinical services and practices at an independent community wellness pharmacy called Hobbs Pharmacy. She's also founded the Athlete Pharmacist and currently also consults with clinical sports pharmacists for athletes across multiple levels of athletics in the U.S. and internationally. Fun fact about her, she's medaled nationally and internationally in Olympic weightlifting, and at 41, set a world record in the snatch. So let's be real, she's the real deal.
Well, thank you for that introduction. I appreciate it.
Absolutely.
Yeah.
Excited to have you on. I think, talking about sports pharmacy is definitely a newer subject that I don't think a lot of practitioners have heard about before. Genomics is definitely coming on the scene, and that directly integrates with food, especially like nutrigenomics. So I think this is a really opportune time to have a discussion about this, but welcome.
Welcome. Thank you for having me. I appreciate it. I'm excited to get some information out there about sports pharmacy and genomics and see where this conversation goes.
Absolutely. So can you tell us, what is your roots?
Yeah. So my roots, I guess my roots really do reside in sports. Both of my parents were athletes. I was a good multi-sport high school athlete, played Division I volleyball. And it was kind of during college that my love for like healthcare and kind of figuring out how the body works. I have an undergrad in chemistry, biochemistry, and stuff like that. So it it kind of started there, and I started figuring out why are we making these chemicals for these receptors and what's going on with the body. At the same time, I was struggling through playing college volleyball, and it all just kind of came to a one day, and my professor said, "Hey, you should go to pharmacy school." I had never thought about it. So I started working in a community pharmacy in Asheville, North Carolina, and we had an herbalist and a naturopath on site. So I did a lot of information on supplements and diet and lifestyle before this was really a big thing. And so that's kind of where my roots started. And the path has just been kind of like a windy path since then. But starting in doing Olympic weightlifting, it's a drug tested sport. So I had a lot of like teammates and people asking me questions about supplements and safety and are they banned, are they not banned? And so years ago, I started what was sports pharmacy that I didn't even know existed. And I had a lot of people asking for consults on like hormones and how do they recover better and their nutrition. And so I started a consulting firm on the side, and it's just blossomed since then. And sports pharmacy in the US has probably in the last year just skyrocketed. It's internationally well known kind of for anti-doping, but in the US, it's taken a bigger role into kind of being part of an interdisciplinary team for the athlete.
Well, athletes is a very high revenue sport, and they're the 1% of the 1%. So everyone's trying to do as much as they optimally can to keep them from getting hurt, keep them from getting sick, and how am I going to perform better than the person across from me? So wherever we have to look for help for that, we're going to do that. Where we have to look to make sure everyone's also on an even playing field,
Right.
people are going to do that too. So obviously those investments and opportunities are there. And I like what you said kind of earlier, the body is very unique. I don't think we're ever going to 100% figure out everything about the body, but there's always something new that we are finding out every single day, month, year. It's constantly new research coming out all the time, which makes it very fascinating on how we can continue to keep optimizing that too.
Yeah, there's so much out there. I like you said, I don't think anyone's ever going to fully understand it. Plus the nuances between you and me, even between me and like my brother, genetically we're same parents, but still totally different in different aspects. So I think that's what makes it really unique and challenging. And basically every athlete is an N equals 1 case. So that's kind of fun.
Yeah. So if I'm a practitioner like myself, a dietitian, or let's say a strength and conditioning coach, and they're coming up to you and they're like, what is sports pharmacy? What would you tell that individual?
So we had this discussion the other day with a bunch of us that are pretty leading the charge in the US, and we don't have a definition. We haven't defined it. It is a new field in the US, and I will try and explain it as best as I can. Sports pharmacy is pharmacists working as part of an interdisciplinary team to support athletic performance and human performance. And we do that in different ways. It may be anti-doping, it may be looking at clinical labs, it's looking at supplement recommendations, it's looking at medication recommendations, but also how do those medications and supplements interact with each other, interact with your performance, interact with your genetics, interact with all of that. And also taking a bigger approach in how is that also affecting lifestyle and long-term longevity, both in sport and just in human longevity.
Mhm.
So we haven't, I wish there was a good definition I could like read, but it is an all involving, very, very new area in the US. And we're coming up with like mission statements for some of the new sports pharmacy groups, but everyone's kind of trying to see how it goes before we completely define and kind of put us in a box.
So I guess like what is your process then? If you're working with an athlete, are you getting certain biomarker tests? Like, are you doing a gene test right off the bat? Or are there specific markers that are your go-tos that you look for? Like, where do you even start when you have these conversations with a team or different athletes?
So I usually start, and you may find this, a lot of people find it surprising as a pharmacist. I start with the foundations of like, how is your nutrition? How is your sleep? How is your training? How is your recovery? And what are you currently taking? I mean, I am never going to say I'm a dietitian. I'm never going to give like a food recommendation, but I have enough knowledge to know like, are you under eating? Are you getting enough protein? Are you getting enough carbs? Are you getting enough of these or micronutrients of like a female athlete? Are you getting enough iron or calcium, different things like that? So I kind of start by taking a whole look at the patient or the patient athlete. And then we're kind of customizing based on what's going on. So not, like you said, not everyone's the same. So not every person they're trying to gain weight. Some are trying to maintain weight. Some are trying to recover better. Some are having sleep issues or anxiety issues. So from there, we start looking at specific concerns of the athlete. I will tell you, the majority of my athletes, especially my younger ones and my collegiate ones, I'm not pulling nutrigenomic panels off the bat because there is so much foundationally that we can do before we're looking at these nuances. It's kind of like, I don't automatically start adding supplements because I'm like, wait a second, you're not getting enough protein in the beginning. So I don't care if I add a supplement, it's still not going to fix that. So depending on the level we're at, I do a lot of like lab recommendations. So female labs, female hormones, males, just lab profiles to see where they're at with different biomarkers, and then kind of start customizing based on, concerns.
Yeah, you get into some of these age groups, and I like you said, basically you start with the basics: sleep, hydration, fueling. I mean, it's not
Yeah.
sexy, but guess what? That's the things that are going to work, and that's the things that you have to do every day, and
Yeah.
that's what's going to probably make up the 90 to 95% of what's going to make you a good athlete at the end of the day, if you can do those at a very high level.
I
And
agree 100%. People find it, I was like, I know it's not sexy, it's not Instagram worthy or TikTok worthy. It does. And I tell them all the time, like, I work in a community pharmacy and I'm talking to 60-year-old people at the desk about nutrition and sleep and hydration because they have now avoided it or not optimized it. I tell them it's a skill that you learn throughout your life. It's constantly evolving based on like what's going on in your life, what stage you're at. But I'm talking to diabetic patients because they've never understood how to sleep right or control stress or nutrition. And I'm like, we're trying to set this foundation now so you're not at that point after sport and everything that you're diabetic or, overweight or hypertensive because of the lack of a foundational skill.
yeah, and if you don't know, you don't know. If you don't
Yep.
have someone to be able to teach you those things and you're
Yep.
going throughout life and you're 50, 60, you're just doing what you did in your environment, doing what your parents taught you, do
Yep.
what the people you grew up around. I mean, that's how you're gonna accumulate those behaviors. And until someone
Yep.
like ourselves comes into the picture and says, hey, like you should do this, this, and this, and you could feel this much better. And then a week or two, all of a sudden their energy levels rise and they haven't felt that good in 40 years. they're probably going to come back for some more questions because they're like, well, I want more of this
I
because
want more.
I've never felt like this before.
They're like, wait a second, I don't have to take any more medicine, and you can actually help. Like, I can just do these little things. And I feel like it's super impactful to be able to give patients or athletes skills that they can use for different things instead of being like, hey, you need another medication or you need another supplement. Like, sometimes less is more, I feel like.
And you can probably tell me, like, isn't it like 60 to 70% of diseases typically comes from
Oh.
exercise and nutrition, like alone?
Yes, exercise, nutrition, and stress. And I think it's probably like 70 or more. Most of them have to do with, lack of foundational skills or not being able to apply it or just not doing it.
Yeah. So how do you integrate yourself with a like an interdisciplinary team? So obviously, sometimes you may be in situations where you may have to ask a lot of those questions yourself because maybe they don't have a team. But then, what do you do as you transition to like working with an actual sports team? Do you collect a lot of information from them first,
Yes.
and then if you're seeing like, all right, athlete A has 2 red flags, athlete B has 4 red flags, that maybe cuts down on your process and allows you to essentially target maybe what you want to do or what you think should be done?
Yes. So if we're starting to look at teams and work with a team overall, I start looking at overall trends and what can get us the most bang for our buck. Can we get 8 athletes because maybe their training load is too much, or we're over like we're over stressing them. And so there's an over resounding kind of theme among most of the athletes. So we start there. And like, I work with like ATs and PTs and team dietitians. What are you seeing in this team? What are your trends? What are you seeing? And trying to be that like intermediary between everybody. Maybe they don't always talk to each other, but hey, I'm trying to grab this information from your nutrition perspective, plus the AT perspective, plus maybe the ortho perspective or sports med doctor. What are you seeing? What are you constantly being treated for? And then kind of see, okay, how can we get the most bang for our buck? And then start working one-on-one with the nuances.
Are you seeing specific trends like in athletics when it comes to, let's say, biomarkers, for example? Like one thing I see, it's pretty chronic, is low vitamin D, low omega-3 levels, low magnesium. I mean, I think probably wherever you go, if you do get the opportunity to do biomarkers on your athletes, you're probably going to see some type of deficiency or low level there. But
Yes.
anything maybe outside of that that's common, or does it depend on maybe the sport and if they're inside and outside?
Yeah, I was gonna say vitamin D, and like you said, vitamin D, magnesium, omegas are definitely at the top of the list. I do see a lot of inflammatory markers. So some of the inflammatory levels like CRP, homocysteine, those can be definitely inflamed. Some of it has to do with like training. When did they get labs done? Are they in season? Are they out of season? Some of it's known. Iron in my female athletes, pretty common, low iron levels, especially in my the endurance athletes, more likely, or some of the weight class sports where they're kind of cutting or maybe under eating. So I see that. Those are probably the biggest ones. And then the next one that I do a lot of my clients happen to be female athletes. And so I do see a lot of hormone issues. So low levels of like progesterone and estrogen, even thyroid, because they have just either undertrained, which I like to say overtrained or under recovered and
Yep.
under ate. And so we start seeing some low levels of hormones. So some periods being longer or skipped and stuff like that. So
Yeah, I mean, I think I saw the recent Reds article
yeah,
just came out a few weeks ago, so
the
that
new
was great
guidelines. Yeah.
to get an update there. And it's also sad, a lot of times with these female athletes and the coaches and maybe some of the people they work with, like just make them think like not having a period or having these changes is just normal, like it's just part of athletics, and it's like no, like that's not the case. If you're having like X, Y, and Z happening, that's not normal. You need to be getting checked out. You need to be talking to some practitioner to try to like figure out what's going on because you're probably gonna be at a risk for a high injury or illness in that case.
Yeah, and not to mention like I've had one athlete that we had when I got her had already had multiple stress fractures, and I was just like, what in the world? Like, and so a cycle of like 45 days. And I was like, that's not normal. Normally it's like 28, give or take a couple. So we need to figure out like what's going on. So yeah, diving in, luckily my background in my community pharmacy, I do a lot of hormone therapy consults with perimenopausal women and menopausal women. So my background in hormones have really helped me be able to, talk and help younger athletes understand like what's going on.
So I have a question for you here. So like a lot of times when we go to physicians, right? Yeah. And we know like some of these biomarkers or micronutrients are probably going to be deficient.
Yeah.
But most physicians and most insurance companies won't cover to get them done, even though we know that they can lead to several different problems. So I don't know if you have the answer to this question. Like, do we know why insurance companies won't cover these? Like, obviously, if we can supplement them with them and we can get them back to an optimal level, that's going to help them, or is it just, everyone kind of blames big pharma, like big pharma wants to just make revenue. Maybe what's your opinion or feedback on that? I've always wondered, like, I guess so many different opinions.
So I think vitamin D is a prime example of this one. Unless the doctor is willing to put a diagnosis down that you're vitamin D deficient, 9 out of 10, the insurance isn't going to cover it. Mm-hmm. And in essence, it's not an expensive test. You could technically, as a patient, go on to like a website, like I use Ulta Labs, and you can get a test and do it yourself and have it done at Quest. You can pay for it yourself, which is super cool these days. But insurance, I think, is trying to get away with the minimal possible. And this is obviously a much larger conversation of like, it's not so much, and people might cringe at this. It's not so much, it's big pharma, but there's actually a group in the middle called PBMs, or prescription benefit drug managers. And so that's like your Express Scripts, your CVS Caremark, your Optum, and they're the ones that process and kind of are the middleman. They're the ones that are really,
what's the best way to put it?
I'm trying to figure out how to put this. They're the ones making all the money and causing this upside down system. They're saying, we're only going to pay you $50. Or maybe not cover it, or maybe require prior auth or this. We're going to then bill the insurance or the employer $300, and they net the difference.
I mean, it's like when I was in clinicals when I first started coming up, and people will get all up and into like, wow, why is my bill $30,000 or something like that? They're charging me $50 for a Band-Aid, and I'm like, well, if the hospital doesn't charge them that, they probably might even not make a quarter of that. So like they have to charge these outstanding prices. It sounds insane, but the hospitals are also a business, and to be able to stay afloat, to be able to serve the community and make sure everyone gets what they need, like they also need to make money to be able to pay everybody and keep the lights on too. So, it's unfortunate. It just seems like this vicious cycle that occurs.
Yeah, I was gonna say, it's a system. I feel like it's starting to come even more, especially in the pharmacy world, to the head of like prescription drug prices and coverage and copays and all that. It's been festering for a while, but it's definitely more so now with like insulins. You start seeing it in the news and stuff like that. So big pharma is not exempt from what they're doing, but it's definitely, there's some other middlemen in there that play a role that kind of somehow skirt under the radar when people start looking at healthcare.
Yeah, even when you're charging individuals that need the medication, like they can't help it, like they need it, and then you're charging like double, triple, and then do I choose rent and food, or do I choose the medication? And like the fact as a human, we have to come down to that decision just to stay alive.
It's sad.
It's bad.
So sad.
It's really sad.
It's so sad.
Shout out to Merrick Health though. Great option if you need to get blood work done.
They're a great one too. I was gonna say there's some great ones out there. That's we all I'm sure have our own. So I think that it's a great option, and the ability, I find it beautiful that we now have the ability to be able to run or request tests that we're curious about that maybe the insurance won't cover, or maybe the doctor won't order. I did like fasting insulin. I do that often, especially on my female athletes with maybe possible PCOS, just to kind of get a baseline. And like a lot of times they don't cover it or won't order it because nobody knows how to interpret it. And so I'm like, it's like, $20. It's okay. It's a great marker.
Or this is what I find too, is a lot of our ranges are outdated for athletes or different ethnicities or different populations, So
Agreed.
it's like all right, this research on this lab level was off of a Caucasian male from some 1970 study. How does that relate over to the athletes that I'm working with right now, who's 6'10" and 260 pounds?
Yes. And
you're telling him he's normal, but
correct.
He's clearly training. His part-time job is just exercising, and he's taking in 5,000 calories.
Yeah.
I think his intake and his level is probably going to be a little bit different than somebody else's.
Yeah. We go back to vitamin D, iron, a lot of those biomarkers that we see low omegas, that they're kind of skewed, and like the doctor will be like, they're normal. And I'm like, it's 30. Like, it's not yeah, okay, it's normal for that lab or that range, but not for you as an athlete. And it's definitely not optimal. So, as a clinician, the understanding that what the lab level should be is super important when you're diving into working with clients and being like, okay, yes, I know it's green, but this is nowhere near where we really want it.
Or a lot of the times when they're looking at blood work, right, they might tell you you're normal, but it may be a low normal or a high normal. So then if you're not conscious of that, or you don't know that could be a problem, or your doctor's just saying, okay, it's normal because they have so many patients and they got to go to the next patient.
Yeah.
Well, if it keeps trending low or it keeps trending high, but it's not abnormal, probably something still could be going on that you may want to like take a little bit more effort to look into, so it doesn't get into those ends of the spectrum or extremes.
You mean prevent something before it happens?
Oh, wow. That sounds like a crazy concept.
There we go. There's like, I know, because I've had many people, they're like, the doctor says they won't do anything until it's X number. I'm like, why do we need to get to X number? Like, why can't we deal with it before that?
Waiting is not going to help. I mean, it's the same thing when you go into, physicians sometimes, and these specialty physicians, and you got to wait 2 to 3 months. Like, the person's going to struggle for 2 to 3 months and then see you, but then say like, just take this, and then I come back and see me in 3 months. But that's, that's a whole nother.
It's a whole nother.
But let's shift into like nutrigenomics, genomics. Like,
what
do those terms mean? Like, what's maybe the most up-to-date research on those kind of subjects right now when it comes to relationships with athletics?
Yeah. So everybody, I'll kind of give a little background. So there's nutrigenomics and there's pharmacogenomics, and it's basically the start of personalized medicine. They've been using pharmacogenomics in like cancer research for years and helping target cancer cells. But it's now coming down to actual medications also figuring out, how does your body process? So how does your body either activate the drug to make it active in your body, or how does your body clear it? And so there's a lot of enzymes in your liver that do this process. And based on your genetics, your ethnicity, everything like that, you can, for example, you can be a fast metabolizer of a medicine, meaning it goes through your system really fast, and you may not get the effect of a normal dose. Or you can be a slow metabolizer, meaning that like you take the medicine and it lingers in your system longer, and you're more likely to have side effects. So using genomic testing, you can tell what your genes are, and based on research, we know what goes through certain genes and certain pathways, from inflammatory pathways to vitamin D activation, to how maybe like one of the biggest examples is like Plavix, which is an anticoagulant, or birth control pills. How are they metabolized? So you can get these tests done based on, if you're looking at more nutrition, if you're looking at more drug specific, to tell you how your body processes everything. And the good thing I like about genomics is your answer never changes over the years. It's not like a blood test where it's like, this day it may be high, this day may it be low, next year it's different. Your genetics stay the same. So you will always be, for example, like a slow metabolizer of caffeine, meaning that you're more likely to be sensitive to caffeine. You're more likely to be kind of jittery. It may linger longer. That's never going to change over your life. So we are able to take that information and apply it to medication recommendations. Say you need an antidepressant, or you're on an anti-inflammatory, or maybe having surgery. We can find the medicine that is going to be best fit for your body and least likely to cause side effects, which is amazing instead of this trial and error. And then you can also use it nutrigenomics wise to help optimize diet recommendations, a little less trial and error in what diet may be best, or what maybe like macronutrient ratio might be best. You might be more sensitive to carbs, so you might need a slightly lower carb ratio than what you think, or you might be more sensitive to proteins. But you're able to take all this information and really personalize the research, or tailor your recommendations to the client. And they're super cool. Like, I geek out on nutrigenomics and pharmacogenomics.
Yeah, I know, like we talked about prior to coming on here, you were just like, there's so many pathways and they all intertwine. If this pathway goes to the wayside, this is going to affect this. And it's just kind of like a downstream effect. If one thing gets
Yes.
affected, it's going to have a domino effect somewhere else in the body. But
Yeah.
that's why you can't, that's why you can't just look externally, because
No.
someone could look like they're terrific, but if you're not doing the internal tests,
Yeah.
sometimes you may never know. And that
No.
person can just continue on with that for, who knows, months to years at times, I would assume.
Yeah. So I had a high school athlete. I think she, at this point, she's college level athlete. So she was ending up on like ibuprofen and anti-inflammatories daily for aches and pains, stress fractures. I was like, oh my gosh. And then they started adding like a proton pump inhibitor because she had GI issues. And so the way a lot of anti-inflammatories metabolize, we did a nutrigenomics and pharmacogenomics test on her, because she had by this point been on like birth control pills, proton pump inhibitor, and ibuprofen. And I was like, something's going on here. And so she's a slow metabolizer of NSAIDs. So that makes her more likely to experience side effects. So she was having the GI side effects. So instead of realizing that it was the anti-inflammatory, they just added a proton pump inhibitor, which then caused low calcium and low iron and low magnesium. And she had stress fractures. So they added calcium and a birth control pill because she wasn't having her cycle normal. So we looked at nutrition. We looked at obviously getting off the anti-inflammatory, helping with inflammation, but finding a better option based on her genomics. But I was like, it all started in the fact that she doesn't metabolize ibuprofen or the anti-inflammatory she was on efficiently. So a normal dose is too much for her body, causing side effects.
Yeah, it's just like as a physician, it just seems like they're just dumping on meds. Like, all right, you got this symptom, well, this will fix that. Oh, you got this symptom, this will fix that. And then by the time you know it, you're on, especially look at our grandparents, you're on 10 different medications. Yep. Which one's even working and which one's actually harming you? And then which one's like not allowing the other ones to do what they're supposed to do. And nobody's thinking about nutrition. Like, no one's thinking about medication timing for the most part. They just know, doc wants me to take it, I'm going to take it. Here's my morning coffee, and I'm going to slug down all 10 of these pills at one time. But in reality, like, okay, well, now 50% of these are not even working or being absorbed or affecting something else.
Correct. Yeah. You got it. You hit the nail on the head.
it's somebody that young, right? Like, that's an instant red flag. If someone that young in college is on 3-4 medications already, you gotta do a little more investigation work there.
Yeah, I agree. So I do get a lot of like college athletes, and we're looking, sometimes it's as simple as like they need an antidepressant or an anti-anxiety, and helping them through the stresses of college, and sometimes finding the best choice so that they're not struggling for 4 or 5, maybe 6 months try this one. What's the side effect? Is it going to cause weight gain, weight loss, low energy, not sleeping? And I'm like, you're already having enough stress as a college athlete. So let's kind of cut that, and let's figure out the best choice ideally first and start there.
Or like you said at the very beginning, like, maybe you need to go back to the basics.
Yeah.
Maybe you need to talk to mental conditioning or sports psychology, because you can't seem to handle these new stressors that you're dealing with. So you need to develop some tools to be able to do that, versus finding other means that's just, what I call the Band-Aid. We're sticking the Band-Aid on it. It's helping for a little bit. It's not actually fixing it, and probably going to explode on you later on.
Yeah.
So let's just do some base level work and figure out why you're tired, why you're injured all the time, because it's probably going to relate back to a lot of those things. And if we can fix those, then maybe just that in general gets you off some of these medications, get you to feel better.
True. And I definitely agree with that, is like you said, having that, taking away the stigma of going to counseling or going to the mental health coach or anything like that, and being able to look at, what deep inside, what's going on. And I find stuff that I wish I had, where there's so many tools and so much information out there of how to like breath work and meditation and journaling and this, and like, I was like, yeah, like maybe they told me about it, but nobody said like, hey, this is how you do it and this is how it works. And, give it a try for a couple weeks. And like being able to have all these tools in your toolbox is so cool now these days. So I love the fact that there's all these services to athletes that they can have, but I guess it's removing the stigma and having them feel confident in being able to ask for help and go to these dietitians, PTs, ATs, sports psychologists, and get the tools. And that may be all that they need, like you said.
And a lot of them are competitive, so it's also just like challenging them a little bit. Hey, you're coming with all these negative things. If you don't feel great, this is happening. Like you said, just try this for a week.
Yeah.
Right. Just give what I'm telling you a chance for a week. What's a week out of, the entire year that you have? And,
correct.
Tell me if I'm wrong, but, Sunday, Monday, if you did this one or two little things that I wanted you to do you feel better? And if you can answer yes, right, you're going to make the decision to keep coming back for more questions and getting more help. But there may be something I can do for you if you're seeing a difference in that amount of time.
Yeah.
And a lot of the time we're like, oh my gosh, I feel better. And you're like, yeah, because you weren't doing that for the last 15 to 20 years. So we can't change all this in 2 seconds. And everyone wants that because of the lifestyle we kind of live nowadays. But give it a chance and we'll be able to get you there eventually. Just going to take some time to work with us.
Yeah. Like you said, I think some of it is society these days. They want a quick fix. And I'm like, sometimes this isn't quick. It's little baby steps that add up, and we're going to have to do this stepwise. And, trying to get somebody to commit and understand that can be challenging too.
For sure. One last question I have for you is, so you mentioned like looking at how much carbohydrates you might need, or diet recommendations, or maybe an intolerance or an allergy or something like that. Do you use other tools in combination with nutrigenomics and genomics? Like, do you do a VO2 max? Like, is there just like an accumulation of tests to figure out what your, I don't know, ratio or best plan would be?
No, I don't. I'm not that super sophisticated. I know there's some of my colleagues that work at larger institutions that have availability of that do. Most of my work has been high school and college level athletes that don't always have access to all of that stuff. Like I said, some of my colleagues are with professional teams and they have all of that, and they are using that to definitely hone in the answers much quicker. But I'm looking at like diet logs, training performance journals. Sometimes I even use wearable information that can be very helpful these days, and nutrigenomics together to try and help start an idea or a plan of action.
Yeah, it's always multifactorial. There's several pieces of the puzzle that have to get looked at.
Yes.
So fun fact finisher to kind of end on this note. If you were only to look at one gene or one biomarker, or there may be one of those that could be something someone can look at to help them, what would you choose?
So one of my favorites is like MTHFR for activation of, it's the methylation gene, and it methylates B vitamins. It also takes homocysteine to methionine to help with inflammation. And for women, it can play a role in fertility. So in about 50 to 60% of the country doesn't methylate really well. So it's something you can actually buy, like methylcobalamin instead of cyanocobalamin over the counter as a B vitamin, B12 vitamin. And it's a simple fix, but it can make a big impact because it can make the vitamins feel better. It can decrease inflammation and help with fertility for some of my females. So that's one of my favorites. It's pretty impactful. One of my others, I'll just add it to it. It's not so much that it's a cool gene. It's called the comp gene, and it's got a ton of research behind it. And I always laugh because I can never say it right. So you can be in the middle, but the extremes are someone who's a warrior, like you worry a lot and like you're anxious. And because of the way the gene works, you get extra anxious, but you actually have less addictive habits, whereas the opposite is a warrior, like someone very strong and very like resilient, but those people are actually more likely to have addiction properties because of the way the gene works. So that is one of my favorites, just for like kind of overall kind of what the person's like.
I think that gene would help a lot of people.
It definitely would. It explains a lot when you're like, oh yeah, definitely see that answer.
And I like what you said about the first one. So small side note
Influencer.
before we kind of end here was
Yeah.
I spoke to another dietitian that worked in the NHL realm who has a lot of background in this too. And she was mentioning like, hey, probably a lot of athletes, you should check homocysteine because
Yeah.
they're probably going to be really high. And the last population group that I worked with, the last facility, probably I would say 70%, 80%, like their homocysteine was just through the
Sky
roof.
high. Yes.
So
Yes.
she had mentioned like, yeah, just, use this product, use this type of B vitamins. And she goes, you'll probably have a better opportunity for them to absorb it, or we'll probably have a better opportunity to have them, methylate it in that sense. And then,
That is why.
that then significantly drop that down. And then she goes, well, that also has interplay with, B12 and folate and some of your
Yeah.
iron levels. And like those may be abnormal as well. So if you have multiple of these red flags, they're probably all one thing is going on, or it's stemming from maybe just that.
Yeah. So it methylates B12, it methylates folate, and it methylates homocysteine. So folate can obviously play a role in anemia and iron issues. You have B12 energy, and then homocysteine inflammation. So yeah, it's one of my favorite. It's pretty impactful.
Good to know for the
Yeah.
future when I do that. But really appreciate having you on. I think this is, super unique, and I've had some newer divisions of opportunities for practitioners to listen, like esports, fighting, NASCAR, first responders. I think there's just more and more opportunities opening up for practitioners in our field to associate with, get to know. I think this will be a great episode for people to listen to get some more information on it. But all of her information, Jessica's information, will be down in the show notes. Mine will be down there as well. So if you guys want to contact, communicate, or have a conversation like this, let us know. Appreciate you, Jessica.
Thank you. Have a great day.
You too.